Otitis externa, also known as swimmer's ear, is a common inflammation of the ear canal. It causes pain, inflammation, and discharge. In this video, we will cover the causes, symptoms, complications, and treatments of otitis externa, providing you with a thorough understanding of this condition. In otitis externa, various microorganisms like bacteria, fungi, and sometimes viruses can cause the infection. Common bacterial pathogens include Pseudomonas aeruginosa, Staphylococcus aureus, and Proteus mirabilis. Fungal pathogens like Candida and Aspergillus are also frequently involved. Knowing the microbiology helps in choosing the right antibiotic treatment. Identifying and culturing the causative microorganism from ear swabs helps determine antibiotic susceptibility. Due to increasing antibiotic resistance, it is important to use antibiotics judiciously and consider alternative treatments as needed. Allergic otitis externa is a distinct subtype of otitis externa that occurs as a result of hypersensitivity reactions to various allergens. The underlying immune mechanisms involve type I hypersensitivity reactions mediated by IgA antibodies. Common allergens implicated in allergic otitis externa include pollens, animal dander, dust mites, and certain chemicals in ear drops. Management of allergic otitis externa focuses on avoiding exposure to allergens, as well as utilizing topical corticosteroids and antihistamines to alleviate symptoms. In refractory cases, immunotherapy may be considered to desensitize the patient's immune response to the specific allergen. When treating otitis externa, it's important to be cautious of certain ear drops. Some antibiotics like neomycin and gentamicin can harm the cochlea's hair cells, causing hearing loss. Other agents like acetic acid solutions should be used carefully, particularly if the eardrum is perforated. Healthcare professionals must weigh the risks and benefits of prescribing ototoxic medications and inform patients about potential risks and signs of ototoxicity. Fungal otitis externa, known as otomycosis, is a common fungal infection of the external ear canal. Diagnosis involves examining swabs and cultures. Treatment includes antifungal agents and proper cleaning and drying of the ear canal. Immunocompromised individuals, such as those with human immunodeficiency virus, HIV, infection or undergoing immunosuppressive therapy, are at an increased risk of developing otitis externa. The causative organisms in these cases can be more diverse and may include opportunistic pathogens such as Aspergillus species or nontuberculous mycobacteria. Management of otitis externa in immunocompromised patients requires a multidisciplinary approach, involving infectious disease specialists and otolaryngologists. Treatment often involves a combination of systemic antimicrobial therapy, along with debridement and regular follow-up to monitor response and prevent complications. In cases of refractory or chronic otitis externa, surgical interventions may be necessary to achieve resolution and prevent recurrence. Canalplasty, also known as ear canal widening, involves the removal of diseased or fibrosed tissue to improve drainage and ventilation of the ear canal. Tympanoplasty, on the other hand, is performed in cases where there is damage to the eardrum, often resulting from chronic infections. This procedure aims to reconstruct the eardrum and restore normal hearing function. The success of surgical interventions for chronic otitis externa depends on various factors, including the extent of disease involvement and the individual patient's overall health. Otitis externa in children poses unique challenges due to anatomical and developmental factors. The presentation of otitis externa in children can differ from adults, with symptoms such as irritability, feeding difficulties, or pulling at the affected ear. Causative organisms can also vary, with Pseudomonas aeruginosa being more common in children. Management of otitis externa in children typically includes a combination of gentle ear cleaning, topical antimicrobial therapy, and pain control. Proper education of parents and caregivers regarding ear hygiene and prevention strategies is crucial in preventing recurrent infections in this vulnerable population. In this section, we will compare otitis externa and otitis media, two ear infections with similar symptoms. Differentiating between them is important for proper treatment. Otitis externa affects the external ear canal, while otitis media involves the middle ear space. Clinical examination, including otoscopy, can help distinguish the conditions, along with pneumatic otoscopy to check for middle ear effusion. Otitis media is usually treated with systemic antimicrobials, while otitis externa is managed with topical therapy. Accurate diagnosis is crucial for effective treatment. Malignant otitis externa is a serious complication of ear infection, mainly affecting older individuals with diabetes or immunocompromised conditions. It spreads to the adjacent bone, causing symptoms such as intense ear pain, tissue growth in the ear canal, and nerve problems. CT or MRI scans help diagnose and determine the infection's extent. Treatment includes antibiotics, surgery, and addressing underlying factors. Biofilms are bacterial communities that form on the ear canal in chronic otitis externa. They protect bacteria and make them resistant to treatment. Understanding biofilms can help develop new treatments for chronic otitis externa. Topical corticosteroids are effective in managing otitis externa, reducing inflammation and symptoms like pain, swelling, and itching. They inhibit inflammation and suppress the immune response. Indicated for cases of allergic or inflammatory otitis externa, caution must be exercised, as prolonged use can lead to local side effects. Regular follow-up and patient education are vital for safe use. Severe or untreated otitis externa can lead to systemic complications such as facial nerve paralysis, skull base osteomyelitis, meningitis, brain abscess, or septicemia. Prompt recognition and multidisciplinary management are crucial to prevent these complications and optimize patient outcomes. In conclusion, otitis externa is a complicated condition with many different causes, symptoms, and treatments. Healthcare professionals must be knowledgeable and adaptable to provide effective care and improve patient outcomes.